Have you ever really thought about what's happening inside your body when you get sick? You know, that cough, the fever, that feeling of being totally and completely drained? Well, it's not just you feeling crummy. It's actually a microscopic war, and it all boils down to one single process: infection. So let's unpack how a tiny little germ can cause so much trouble.
Here's our game plan. We're going to start with the basics, like what even is an infection? Then we'll pull back the curtain on the secret playbook every germ follows. It's called the chain of infection. After that, we'll look at who's most at risk and how we can fight back. And finally, we'll put it all together with a very familiar foe, the flu, and see how it can lead to something much more dangerous, like pneumonia. All right, let's start at square one. We throw the word infection around all the time, right? But what are we actually talking about?
Okay, so picture this. An infection is basically an invasion. Some kind of foreign organism, what we call a pathogen, gets inside your body and starts to multiply. Immediately, your immune system sounds the alarm and launches a full-scale counterattack. And all those symptoms you feel, the fever, the chills, the aches, that's just the evidence of the huge battle that's raging inside you.
Now, these invaders aren't all the same. They pretty much fall into four main categories. You've got your bacteria and viruses. Those are the ones we hear about most often. But you also have fungi and parasites. Each one has a totally different strategy, a different way of attacking, but their goal is always the same: to use your body as a home base to survive and make more of themselves.
So how do these tiny pathogens actually succeed? Well, it turns out they all kind of follow the same 6-step game plan. It's called the chain of infection. And here is the absolute key. For an infection to actually happen, every single link in this chain has to be connected. If even one breaks, the whole thing falls apart.
Let's just walk through these links real quick. First, you obviously need the pathogen itself, the germ. Then, that germ needs a reservoir, which is just a fancy word for a place where it can live and multiply. That could be a person, an animal, or even a puddle of dirty water. Next, it needs a portal of exit, a way out, like a cough or a sneeze. Then, a mode of transmission, to travel, say, through the air or by touching a contaminated surface. Finally, it needs a portal of entry to get into a new person. And this is crucial. That person has to be a susceptible host.
And this, right here, is where we get our power back. See, prevention isn't some complex mystery. It is all about breaking this chain. You don't have to eliminate every germ on the planet. You just have to break one single link. Washing your hands? Boom, you just broke the transmission link. Getting a vaccine? You just made yourself a less susceptible host. It's such a simple idea, but it is incredibly powerful when you think about it. Now, that last link in the chain, the susceptible host, that one's really important. So, who exactly is most at risk, and what can we do to make ourselves a tougher target?
Well, a few things can definitely weaken our body's defenses. Age is a huge one. Infants and the elderly tend to be more vulnerable. Same goes for anyone battling a chronic disease like diabetes or someone with a compromised immune system from, say, cancer treatment. But, even things that seem less direct, like being under a ton of stress or living in a place with unsafe sanitation, can make someone a much easier target for infection.
When it comes to fighting back, we really have two main strategies, kind of like offense and defense. Primary prevention is our offense. It's all about breaking that chain before an infection can ever get a foothold. Think of things like vaccinations and just good old-fashioned hand washing. Secondary prevention, on the other hand, is our defense. It kicks in once an infection has already started. This is about things like screening to catch it early, and of course, medical treatments to fight it off. Okay, that's enough theory. Let's make this real. There is honestly no better case study for the chain of infection than influenza. Yep, the flu. I think we've all been there, so let's use it to see how this chain actually works in the real world. So the flu is this super contagious virus that just hits you like a truck all of a sudden and can easily knock you out for a week, maybe two. But one of its most dangerous tricks is how it weakens your body's defenses. It basically opens the door and rolls out the red carpet for other infections to move right in.
And the symptoms? Oh, they are a classic sign of your body at war. You get a high fever because your body is literally trying to cook the virus to death. Then you've got the chills, the muscle aches, and that unmistakable hacking cough, which, by the way, is the virus's favorite portal of exit to find its next victim.
So for most of us, dealing with the flu is pretty straightforward. Your body is doing all the heavy lifting, so you just need to support it.
That means plenty of rest, lots and lots of fluids, and in some situations, if you catch it early enough, antiviral medications can help shorten the misery.
But what happens when that battle inside your body takes a really bad turn? What happens when that first viral invasion weakens your defenses so much that another enemy sees its chance to attack? This is where we run into the very real danger of a secondary infection. And the most common, most serious complication from the flu is pneumonia, an infection that settles deep inside the lungs.
So what exactly is pneumonia? Well, it's an infection that gets way down into your lungs and causes major inflammation in these tiny, delicate air sacs called alveoli. Now, these little sacs are incredibly important. They're where the life-sustaining exchange of oxygen and carbon dioxide happens.
And here's the problem. When pathogens set up shop in the lungs and cause all this inflammation, those tiny air sacs start to fill up with fluid and pus. This physically blocks that vital gas exchange. It's why shortness of breath is such a key symptom. Your body is literally being starved of the oxygen it needs to function.
But here's where pneumonia gets really tricky. It can show up in two very different ways. What we call typical pneumonia is what you probably imagine: a high fever, a really nasty productive cough, and sharp chest pain. But atypical pneumonia, well, it can be much sneakier. We're talking a normal or even low temperature, a dry cough, and just extreme fatigue. It's a lot harder to recognize, which makes it especially dangerous.
So if there is one thing you take away from this, let it be this. If you're getting over the flu, but your fever suddenly comes roaring back, or you start feeling short of breath, that is a massive red flag. It could be a sign that a secondary infection has taken hold in your lungs, and it's absolutely time to get medical help immediately.
So you see, from a simple cough all the way to a serious lung infection, it all comes back to that chain. It's this constant, invisible process that's happening around us every single day. But the good news is, now you know the playbook. You know the links. So the only question left is, which one will you break today?